Good afternoon. Hello, everybody. Let's go through some data points, touch on some topics, and then I'll take some questions. No new deaths over the last 24 hours, over the week so far. So very good news. So far in this pandemic, we've lost 204 of our residents. Certainly, we continue to think of them and their families. Go over testing. I'm going to spend a little bit of time on this. Just because this is the way our community has been essentially analyzing our progress. And at times throughout the pandemic, we've had to pivot on the way we looked at this. In the beginning, the question was, do you have tests? And can you test people? And then it transitioned to symptomatic testing only. Then we made the decisions here to do proactive testing in our senior facilities that were under county health purview. We asked the state, obviously, to do more under their purview. And we started doing asymptomatic testing. We were able to find cases that were hidden and able to attack the virus that way. And then when we really expanded the asymptomatic cases, we were able to do this at the macro level, countywide. And it helped us. And I think it's not an accident that New York State is where it is at this point because of the testing strategy we implemented, certainly here in Onondaga County and beyond. So I'm going to look at some of this data. Since Monday, we've received 6,078 diagnostic tests back. We'll be specific now because there's different types of testing getting approved now, and there's different testing that gets reported different ways. Our 7-day rolling average with diagnostic tests is essentially 0.7. That's where we've been. When we look at the new testing that's been approved, which is being implemented at our colleges and universities, this is important for us to now acknowledge this data. Syracuse University, remember we have 15,000 students. We're back. Lemoyne College, Onondaga Community College, ESF, all back, all doing testing, all doing levels of pooled saliva tests. We are doing back-to-school testing this week. We are doing both pooled saliva and diagnostic tests at the same time. When we get pooled saliva positives, we have the diagnostic test right there. We just send it right to the lab. We don't call people back in. This is our initiative. We're controlling it. To do this, it makes it cheaper for us to do it. But pooled saliva tests are now more affordable than diagnostic tests. So we're going to start reporting to the community on how many we're doing, because a positive pooled saliva becomes a positive diagnostic test. But a negative saliva does not become a negative diagnostic test. We're not reporting these in our data. So we're going to start doing that because that's the only accurate way to really look at the information at large. So we know there's been over 18,000 pooled saliva tests over the last 10 days at Syracuse University alone. We'll report more on Monday on where the rest of it stands. If you take into consideration the positives on the university compared to how many tests have been done, you have 6 positives over that period of time. That isn't a 0.7% infection rate, that's a 0.03%. If we were rounding down, we would round down to 0. Again, in our overall infection rate, we have the positives. Those 6 positives are in our numbers, but all those negatives aren't. So we're going to start detailing this out for the community to see the progress we're making. When we look at hospitalizations, 13 in the hospital. It's down 1. When we have 2 folks ready to return to their residence, being a senior living facility, again, what this means, there's an executive order that if you live in a nursing home or a senior facility, you have COVID, you get sick, you go to the hospital. For you to be discharged, you need to pass a COVID test that says you are negative. Sometimes that could take 3, 4, 5, 6 weeks after you've already been recovered. So these are folks, there's 2 remaining in our hospitals looking to be discharged. That means we have 11 folks right now that are in the hospital receiving services for COVID on a daily basis. 2 are in critical condition. So I want to think about those two individuals. Keep them in your thoughts and prayers. Again, we've been in a pretty good range on hospital numbers. Our infrastructure is not stressed whatsoever related to COVID-19 in our hospitals. Looking at positive cases are up 16 since yesterday. 3,691 positive cases, of which 2 are travel related, the state of Michigan and New York City. 7 are household contacts. Again, household contacts are something that are inevitable. If you think about mom or dad getting COVID, they don't have support, they have children, they still need to raise their children. Very difficult to isolate with those circumstances, so then you may have a child that gets COVID, or you have mom or dad, or a spouse or a significant other gets COVID. They don't isolate effectively enough. The spouse gets COVID. This is something that's been baked into this process since the get-go. Quite a few household contacts today. 7 community spread, of which right now I believe 5 are being investigated still as unknown. 145 active cases, and 3,347 people have recovered. Looking at who our cases have been, 2,121 female, 1,570 male, 320 are under 19, 740 are in their 20s, 493 in their 30s, 440 in their 40s, 544 in their 50s, 418 in their 60s, 306 in their 70s, 270 in their 80s, and 160 in their 90s. We started back to school testing this week. Our health department website, you can go for registration for faculty of the school districts. All of the districts have been scheduled that are going back to school in September. And so, again, today, Tully High School, the staff from Tully and Fabius Pompey are there. Tomorrow we will be at Jamesville DeWitt Middle School for Jamesville DeWitt CBA and Manlius Pebble Hill. Monday we're going to be at ESM for ESM and Link Court staff. Tuesday, Jordan Elbridge for Skinny Atlas, Marcellus, and JE staff. Wednesday we'll be in Baldwinsville for the Baldwinsville High School staff. Thursday we will be at West Hill for West Hill and Solvay. And then the Syracuse Diocese will be at Bishop Ludden, and Syracuse Diocese Schools in Jawonio will also be there on Thursday. Friday, Cicero North Syracuse at North Syracuse Junior High. Then going into next week, Tuesday, September 8th, West Genesee High School. Wednesday, September 9th, Fayetteville Manlius High School. Thursday, September 10th, Liverpool High School at Wetzel Elementary School. And then Friday, September 11th, at MBT Bank Stadium, we will be doing another testing site for anybody who missed those dates. And our county, at all these sites, our county workforce helps work with Upstate and Essentia to man these. On September 11th, I believe my office will be helping man that staff. So that's good. What we're doing here is unique to the state. We've done everything we could, and we're doing everything possible to ensure a very safe back-to-school year. We're investing our own capital, our own personnel to help make this happen, and it's very important to the community. A clarification for those who work in the personal care service field. We've received clarification that hairstylists and barbers and anyone in this field, there had been a regulation that you needed to get tested every 2 weeks for COVID. That regulation is no longer in effect. We got that clarified with the state this week. So that is something that folks should know. And when we've been talking about the economic situation of the county, again, I want to highlight in detail the efforts we've made. To date, we've always said there's an $80 million to $100 million hole via the pandemic with revenue loss and increased costs. What we can't pin it down yet because it's so dependent on sales tax payments that we haven't received yet. But what have we done? We had an early retirement incentive. 160 folks took advantage of that. We've held 300 vacancies in county government, totaling 460 positions today that were filled at this time last year that are not filled today. We cut spending, $18 million worth of spending cuts. We took our 103 line, which is our part-time workers, seasonal workers. We cut that. And now we're planning on using $15 million in reserves to help balance the budget. Unfortunately, it's not enough. So I'll be asking the legislature on Tuesday for a resolution that will give us flexibility to reduce 154,000 workforce hours to our staff, which will mean layoffs. We will work on a week-by-week basis, assessing real-time information as it comes in. If the economic picture gets better, we will not need to lay off as many hours, which is people. These are people. These are families. If the federal government decides they're going to get a stimulus package passed, I know that they're talking this afternoon, that will help. But we can't wait any longer for that. So we're going to ask the legislature for giving us this authority, which will then allow us to make adjustments, but instead of having draconian all-at-once adjustments, we'll be able to take multiple steps to hopefully be able to use the data and have the least amount of disruptions to our workforce as possible. Saying that, happy to take questions.
How many jobs?
It depends. Could be as many as 250. If we don't have to do that, if we get a sales tax payment, Tim, that says we're up 4% of that payment, that buys some time. But essentially, we're out of time on this. Certainly, there's going to be some reorganization efforts in September, but we want to be able to get more data in real time, and if the data looks better than we expected, that allows us to not have to cut through the bone the way that we may have to.
What does that maximum translate to in dollars that you would save?
Yeah, 250 positions this hour. This is probably worth about $6 million to us, this many hours.
$6 million per year?
Yep, $6 million, yeah, per year, except we're getting it all at the end. So if we could spread out $6 million throughout the year, we wouldn't need 250 positions. But because we're within one quarter, it's more positions to get to that number.
Okay, so it's not an annualized number. It's you want
for
to
the quarter.
$6 million for the fourth quarter.
Correct.
And that could start like as soon as September. It sounds like.
We will start reorganizing in September.
What 154,000 hours is that? If like one employee gets 40 hours a week times the rest of the weeks in the year, will that all total 154,000 hours? Is that what that means?
Essentially, it's 250 employees at that. Again, we don't know what we don't know right now, and so what we know is that we can't wait. We're asking for it like this because normally when you have a situation where you need to have a situation with layoffs, you go to the legislature with specific positions and all at once. So I could have gone and said I needed to lay off 250 positions and lay them off all at once, and here's who they are. Go do that. But if sales tax picks up, I don't need to do that to 250 people. It's something less. If we get some stimulus help, I may not need to do that to 250 people. So we're asking for this flexibility so that we have the least amount of impact to our workforce as possible.
What kind of departments would be the first?
We're not going to speculate on that right now, Andrew. We're working through this. Certainly, some of our, again, 460 positions are already gone. So we've essentially already gotten rid of 460 salaries. So we're already hurting, and we're doing more, right? I think you pointed out, Trish has pointed out, others, there was no COVID mask wearing, physical distancing, food enforcement units. There's no inspection units for gyms. I appreciate what the state's trying to do for elections, but with all these absentee ballots going out and allowing that to happen, they didn't send any checks with that, right? So that's a lot of work. That costs us money. It's an unfunded mandate. Whether you agree with it or not, it's unfunded. So we're doing more than we've ever done. We have the most efficient and hardworking county workforce in the history of county government. So I'm very frustrated that this is where we are.
What do you think about the new CDC guidelines as far as testing goes?
Yeah, I think I don't get it, to be honest with you, because here's what's going to happen. Even though in some of the guidance it said communities with low infection rates can do some asymptomatic testing to monitor, even though they have that language in there, the insurance companies are going to say, oh, you can't go do asymptomatic. We're not going to pay for it. And they're going to use the because it's worked for us. And we'd be happy to talk to the CDC about our experience here and what we've done with testing to get this pandemic under control. But certainly how they got to that position, I don't know. But I could tell you asymptomatic testing in this community has worked.
And you'll continue to do it?
If people that can pay for it. The saliva pool sampling is cheaper than diagnostic. So maybe that's the way we have to do it. It's a challenge. Now, the Abbott, I saw the president announced the new Abbott test. I don't know enough about it. It's a $5 test, I believe, an antigen test, and that they're coming out. I mean, that could be a game changer in all this. I don't know how accurate it is. I haven't talked to Dr. Gupta or any of our people yet, but a low-cost test could be used in so many different ways to fight the virus and reopen your economy. Numbers up for a day or two, but it's only a day or two. It's not reason to panic if you get them contact traced and you box it in. The problem is when that cluster doesn't get identified, and then it's moving on and moving on and moving on and moving on, and all of a sudden you got 500 people that are positive instead of 50. So we don't panic when we see numbers go up for a day or two and then they go back down, as long as we know what's happening. And if you don't test, you're not going to know what's happening.
Would you ask the CDC to reverse its guidance?
Yeah, I think they should. I think you should. If the CDC is going to take that position, knowing that insurance companies are going to use that as a crutch, not to cover testing, get more test kits out to local governments, get us the test kits, get us the money to get to the labs to pay for them. You have some left, according to the Wall Street Journal, I believe. So get that out. Let us use that. If you want us to go use all that and not put the stress on the private sector, that's fine. Get us the money then.
When was the last time there was a cluster here that you can identify?
There's been various clusters. I'm not going to talk specifically about it because there's not a gap in the investigation, but the same trends that we've talked about before have happened, where you're talking about gatherings. Somebody thinks they got allergies. Next thing you know, they got COVID, and so does everybody else who was at the gathering. So those things have happened, and that's why we've certainly, if you have light symptoms, we highly encourage testing.
How many school employees showed up yesterday for the testing, do you know?
I don't know. We can get you the number. Do we know? 120? 120.
Tim, you didn't watch News Channel 9 last night.
Andrew had it? Okay,
I
I didn't.
did.
Neither did I, Andrew. So don't get mad at Tim.
How's
I didn't
that-
have that number
how's that
yet.
120 out of how many who were eligible?
I don't have the answer to that. We can work with the districts, but again, this is something. Who did we do yesterday? Lafayette and OCS, two smaller districts. That could be pretty good participation. We're doing this for them. We're doing this because we heard teachers say we're nervous. We want that insurance. We're doing it for you, so please take advantage of it.
You're talking a lot about the budget issues for this year, but it's time to start thinking about a budget for next year. How stressful is that right now that you don't really know what next year is going to bring or what situation you're going to be in come January?
So one of the things we did for next year's budget is we moved back the time period that we present the budget. So I'll be presenting our budget, I believe, November 3rd. I think it's a Wednesday, the day after Election Day, I believe, or 4th. I will have 2 months worth of information that normally we don't have when we're adopting a budget for the following year based off of that. So the big number is, what do you forecast out for your sales tax growth, if any? So we'll have better information. Certainly we're going to anticipate some growth because we shut down for 2 months. But then I think we'll have clarity, hopefully, related to any federal stimulus to states and locals. If the state gets some, does that mean our cut for 2021 is less than the $20 million? Does that mean our cut for their budget year, which would be 21-22, but our year of 21, is it sustainable? Is it going to be the same number next year? That helps us, but we've put ourselves in a position for 20 to absorb some of this with all these vacant positions that we start the year out with. But certainly it's not going to be easy. It's going to be a tough budget cycle, and whether we have any more additional pain, we won't know, at least right now. The weeks to come in September and October will really help show what options we have. And in any budget, it's about your priorities and what services we can do. Certainly a pandemic highlights what public safety, public health, taking care of safety net for our poor. At the same time, we still got to make investments in areas that drive economic growth and infrastructure. So it's a balance. So we'll find that balance. We'll put forward a budget that will be in line with our principles. At the same time, try to point towards the future at the same time.
Where's the county at with the sewage testing project?
Yeah, so we are looking at, right now for us, it tells us what we already know, that there's the virus is in these different wastewater systems. We're working to see if we can get it micro-targeted using the resources that we got. Syracuse got a grant money from the state to work with us on it, and to maybe use them to micro-target specific buildings in the county rather than just our wastewater systems. We aren't going to get to zero. At one point in this process, I think there was hope that we would get to zero for a period of time, and then it would come back, and then the first way we would see it coming back would be through wastewater. So at the that's not going to happen. So at the macro level, the wastewater testing isn't as important. Where it could be valuable is at the micro level, a specific building. Can you do wastewater testing in a nursing home? Your largest nursing homes. Can you do it at your largest schools? Then when you see it, if we don't have any positives, but we see it, you go in and you test everybody. So that's how I would like it to work out. We're working to see if we can make that happen.
Because I know SU was thinking about doing it. Have you talked to them at all?
Well, they're doing it at the micro level right now on their campus, and they're the ones who got the money to do it with us. So right now they're our partner now. We were the first ones to partner with them, and they used our partnership to go get state money to go do it in other areas as well. Again, I see the value in going in specific buildings where you have the most people or vulnerable people as an early detection sign. That's what I like to see. Hopefully we'll be able to update you on that soon.
The child care centers are not getting the rush of calls that so many people projected. They're hearing from people that they're not going back to work. They're either working from home, staying on unemployment, they're going to take care of their own kids. Can there be any kind of guidance from your level of leadership, or would you like it from the state, that says, here are the people that should go back to work, here are the people that should stay home?
Andrew, I'm not ready to get into giving guidance on this. I can tell you part of your question, or part of the answers to some of your questions, are troubling. They're going to stay on unemployment. Okay. How long? You think that $300 is going to stay there forever? It's not. And so a society that is encouraged to be on unemployment instead of at work, that's an unsustainable model. So that doesn't work for the community, but unfortunately, that could be the best option that a family has right now due to the circumstances. So we're still trying to assess where this is all going to land and how bad it is. Right now, we've surveyed our own workforce, trying to understand our own families, what their needs are, and does their job allow them to be at home to cover those gaps? And that's something as an employer we're trying to be accommodating with. But at right now, I think we're in this space. Nobody knows how bad this is yet, and some of the answers for families aren't good answers. I got to spend an extra $600 a week or a month because my kid's not in school these 2 or 3 days. Those aren't good. They got to answer there. Those aren't good answers. Do you think anybody wants that to happen for their own budgets? So it's a complicated issue, and we don't have our arms around it yet.
Is there anything new to report about the STEAM school and the plans for that project?
Yeah, so we're waiting. I think we're very close with a lease with the city and the school district. And the city will have some approval. I think we're getting there. As soon as we get that done, and if they need council approval, Tim, once they get that, we'll certainly start the procurement process to get the design team procured and the engineers procured so we can get that going. Other questions? No? Okay. Well, thank you, everybody.